Back at 6:45 this morning, finding access to mental health care has proven to be difficult. The state reports between July of 2022 to the same time last year, the suicide crisis lifeline 988 saw a 10% increase in calls. About 121 call takers answer about 20,000 calls a month. So clearly there is a need for a care provider, but securing the right one is a challenge one family knows all too well. The search, as they found, likely one of their toughest battles. Our 20s, some might say, are a time for new experiences and living life to the fullest. And for 27-year-old Justin Jones, nearly 10 years of mental health challenges. He devoted his early years to being a studious guy.
I had a 4.2 GPA when I was in high school, so I took 11 AP and IB courses.
But he says around age 15, anxiety would creep in, halting his scholarly achievements.
I definitely associated kind of with the bad crowd.
By his senior year, Justin recalls experiencing symptoms of a psychoaffective disorder. He's now been diagnosed with that and at least 3 other mental health problems. The long journey to finding the right care provider begins here.
My parents got me a therapist when I was in high school, and that did also help.
But not enough. He's experienced psychosis, had a short stint in jail, turned to drugs and overdosed in 2016. And over time, he says he's visited at least 30 mental health care facilities. And his search is like hundreds of others. Finding a provider these days is proving to be more difficult. One therapist telling me right now, she has 50 people on our waiting list.
The lack of resources, and I'm not just talking about human resources, but economic or fiscal resources, makes it very challenging for us.
Gloria Cisse, a therapist in Macon, says we are in a mental health crisis. According to the Rural Health Innovation Center, Central Georgia has nearly 1,200 mental health care providers for nearly 590 people.
We are absolutely acknowledging we have a serious issue.
Todd Jones, a state representative from Forsyth County, says Georgia lawmakers have allocated at least $700 million for mental health care access. This challenge, a personal one, because Justin is his son.
I know what it's like to walk in on my son when he's in such a state of psychosis, he didn't recognize his own mother.
He and other lawmakers introduced the Mental Health Parity Act in 2022. Legislation, among other things, requiring private insurance companies and Medicaid to treat physical and mental health illness equally.
How many times we're trying to solve something through legislation and we're literally able to say to our other legislators, hold on, that's not how it works in the real world.
Jones says places like the National Alliance on Mental Illness in Central Georgia are part of a multifaceted solution. The organization helps those experiencing mental illness find stability through an extensive educational and housing program. His son and 22 other people are living in this group home in Warner Robins. His time here will soon come to an end. Grateful for how, in just 5 years, this place has dramatically improved his life, he's happy to be leaving a much different person.
Ready to enter the next decade of my life kind of on a positive note.
Well, Justin plans to return to Georgia State University and finish getting his bachelor's degree in global studies. Meanwhile, NAMI is planning to expand their housing program. Leaders open another facility this month. Another organization in on this fight for better care, the Georgia Department of Behavioral Health and Developmental Disabilities. How they're helping will be on 13WMAZ.com. Caitlin.